Hi, I'm Derek McCammon, podiatrist and foot and ankle surgeon with Advantage Orthopedic and Sports Medicine. I thought I'd today give you a little overview of bunions. Bunions are extremely common in our world, and a lot of people have some misconceptions on them. Overall, they seem to run a bit more in women, about 3 times as common in women over men. We're not born with them, but there are a lot of controversies as to how they develop. They seem to develop with time. Shoe gear is our biggest instigator for pain with just the shoes rubbing. Therefore, women with typically and stereotypically tighter toe box shoes seem to rub them and create more pain, and we see women at a much younger age. Men, we see them at a lot older age, it seems like, typically, and have a much greater severe deformity. What is a bunion? Bunion is where the big toe starts to move over towards the second toe, and essentially I describe it as a slow progressive dislocation of the big toe joint, and it is not necessarily a painful deformity, but can be very painful. So small ones can hurt a lot, large ones can hurt none. You can be 90 years old and get your first pain. You can be in your early preteen and teenage years and have significant pain. This is essentially a normal foot for the most part, understanding that it's a plastic bone model with rubber bands. What we can see here is almost a normal toe position for the big toe. We have a normal angle or position between these bones labeled number 10, number 11. First metatarsal, second metatarsal, and I'll show you what a bunion ends up doing on this anatomic model, but it's basically a protrusion here. So over the course of time with walking, this first metatarsal bone essentially moves out like this and further away from here, but the big toe does not go with it, or we'd have some interesting looking toes. But what happens is the big toe slowly moves over this way. And at its worst, it can usually create a hammer toe of the second toe, and the big toe will actually slide underneath the second toe, and we can get what's called a crossover deformity. That definitely is a surgical problem because there's almost nothing that we can do other than just shoe gear modifications. But that is about as bad as it gets. Shoe gear is probably the first line of defense, and I emphasize that daily with folks. There is no need for surgery on a every case basis, as surgery is not a guarantee. It can take a non-painful bunion and turn it into something that hurts for the rest of your life. But we here at Advantage Orthopedic highly recommend evaluation and consultation for these, and to pick and choose the treatment based on your personality, your lifestyle, your job, your activities, and your future desires. One of the biggest things that I do recommend to people is that if you don't have pain, it's still okay to be evaluated because there are side effects to bunions that can come out, and that's just pain away from the great toe region and the bump of a bunion. The second toe and around the second toe joint is a very common secondary side effect to these. So many times we just simply recommend the shoe gear again. Sometimes we recommend a prefabricated or even a custom orthotic device. There's a lot of off-the-shelf padding and stretching devices to help manipulate these joints and reconstruct them and stabilize them and hopefully slow down the progression and worsening, but allow you to be back on your feet without surgical intervention. But again, we are here for you and would love to see you and give you our advice as to what you can do for this. Thank you.